Hey gang, Anne Marie here. Welcome back to the Sandwich Generation. I'm a certified senior advisor and I'm here to help you guys figure out how to get through all these things. And today I want to talk about someone who has really helped me lately, and that is Aspen Trinity Care and Wellness. They are here in Arlington, Texas, and they have saved me from going to the ER twice now, and I just have to sing their praises to you. It feels comfortable. It's in an office setting, but it's not super clinical feeling. You have recliners to sit back in and they're comfortable. You can even look out the window and watch Six Flags and the rides going by because they have such a great view. And even though it is incredibly sterile, even though, they follow all the procedures that one would need to follow to make this a really safe place for a medical thing, it doesn't feel like that. It feels so much less invasive, and it's quiet and it's peaceful. And by the time I got home, I wasn't all revved up and upset the way I am every single time I go to the ER. So recently, I had another bout of a long COVID situation. I had COVID back in 2020, not any time in the recent past. And sometimes, if I work too hard or whatever, I get so fatigued, I get sick. And in the past, that has sent me to the ER many, many, many times. And it cost a fortune. And they take me to the ER and I can barely move or walk or even stand, and they do a bunch of tests, and all they do is just hang an IV bag of fluids and then say, yep, we don't know what's wrong, you're fine, go home. So I took a little bit of film about them so you can see it, and I just want you to see how special these people are.
I'm Ben. I'm a nurse practitioner.
My name is Gloria. I'm a PA, physician assistant.
Right. And prior to this, I've been a nurse for about 12 years, and I worked in trauma, interventional radiology, and vascular access, where I put peripherally inserted central line catheters and midline catheters for medications. I decided to go to nurse practitioner school, family nurse practitioner school, and do my graduate program, and completed that about in 2001. And
So I started my career as a unit secretary, kind of had to climb up. Then I eventually did monotech, and then I did respiratory therapy, which I lasted for about 9 years. Then I came to Dallas, did that for a year, and then I applied to other schools for physician assistant, and then I've been working as a PA for about 2 years now. Physician assistant is basically, we have a master's degree, so we can treat, we can diagnose, with our credentials there. I work in urgent care currently, so I am the provider that the patients will come and see me at that time.
I've been putting in IVs and PICC lines and midlines for over 7 years. I've been doing IVs for probably 12, 13 years. So I've been good at it, and usually patients don't have, or clients don't have, difficulty with placing an IV. We decided we need to do something beneficial for clients, to help them, educate them. So when they come and see us, we educate them on a good, healthy lifestyle, how to prevent certain chronic disease like hypertension, diabetes, and generally taking a proactive step towards their health. We provide IV hydration tailored to their needs. If they want to feel like they need a little bit of energy, or if they want relief from fatigue, or if they're traveling and want to feel like they need a little bit of immunity booster, we have IV hydration tailored for their need. They have pain, chronic pain, fibromyalgia, osteoarthritis. We have IV hydration tailored for that as well. We also have vitamin shots like B12. Helps you with your energy, mood. We also have biotin that can help with skin and hair. Alpha lipoic acid helps people with neuropathy, and vitamin D shot based on your lab levels. We can provide that as well. And the goal is to prevent them from going to an emergency room or urgent care, and maintain a healthy life. make sure all the products that we do here are sterile, and we maintain that sterility by using a hood while mixing any vitamins and using the proper technique. Since I have the experience of doing these PIC lines and IVs over the years, I have mastered the technique in maintaining a sterile field. Uh, that's very important. We don't need to get any kind of infection. We mix our vitamins in a hood, sensory hood, to keep it clean without trying to prevent any contamination while we mix. So we try to maintain a sterile environment while we do all the mix to maintain the standards of practice. Starting an IV itself, even though it may sound simple, maintaining an aseptic technique while starting, we can make sure that patients don't get any kind of infection. Getting that first IV with that first shot is important for the comfort of the patient too. Making sure everyone who walks through these doors are comfortable and not in any kind of pain, and leave happy.
It is just the most incredible experience as someone who has been to the ER a million times since I had COVID in 2020. This is really a game changer. So I hope that you'll go see them and give them a try, because they are the best situation you will ever find for these kind of things.